So just to start off in talking about COVID-19 illness in adolescents and why parents might want to consider COVID vaccination of their adolescent, most children do have mild or no symptoms if they get COVID, but some have required hospitalization, intensive care, ventilators, or even have died, unfortunately. North Dakota has reported 20 hospitalizations in adolescents ages 12 to 17 since the pandemic started. Some of you may have heard about multi-system inflammatory syndrome, also known as MIS-C. Children who develop MIS-C have an inflammation in their bodies and problems with many organs, such as their intestines, their lungs, their heart, their kidneys. 60 to 70% who go on to develop MIS-C end up in the intensive care unit. North Dakota has had 8 cases of MIS-C since the pandemic started, and there's been almost 4,000 cases in the United States. And then sadly, in rare cases, children might die of COVID-19. Children with underlying health conditions, including asthma, diabetes, or obesity, may be more likely to develop severe illness. And in North Dakota, we've reported 1 death in the 12 to 17-year-old age group. And then nationwide, there's been 127 deaths. So far in North Dakota, 13% of children 12 to 17 have tested positive for COVID, meaning there's still a large number of children who have not yet either tested positive or had COVID and could be susceptible to COVID-19. And we have been seeing increases in this age group. There was a 38% increase in cases from March to April, and 78% of our confirmed cases in this age group do have symptoms. They have headache, sore throat, and cough. In most of the cases, we did not know where they got COVID. They were reported to have gotten it out in the community and didn't have a close contact that they were aware of that had COVID-19. The last thing I want to mention about the impact of COVID on children is that there's not a lot of data about what the long-term impact on children is. Early on in the pandemic, we really focused on the elderly, testing the elderly, people with underlying health conditions who were older. And so we're just starting to learn more and more about COVID-19 and long-term impacts in children. There have been some recent studies, one in the UK. They surveyed parents of children who had persistent COVID, and out of 510 children, they reported an average of 8.2 months of persistent COVID, and only 10% of those children returned to previous levels of physical activity. Another article out of Italy found that more than half of pediatric patients previously diagnosed with COVID reported at least one symptom 120 days later. And 42.6% in that study reported being impaired by symptoms during daily activities. So overall reasons to consider vaccinating adolescents are that the COVID-19 vaccines have been shown to be safe and effective and provide protection from COVID infection, hospitalization, and death. Vaccinating everyone in the community allows us all to get back to more normal activities like no longer masking or going to large gatherings. And children then are able to return to their routines and activities that they love. Many children have a grandparent who would be at high risk for developing severe COVID-19. And so vaccination of adolescents will prevent them from transmitting COVID-19 to those around them. And fully vaccinated adolescents with no symptoms do not need to quarantine if they're exposed to someone with COVID-19, meaning that they'll be able to attend school and stay in their activities that they love. The trial for Pfizer's COVID-19 vaccine, the phase 3 trial, did include 2,260 children ages 12 to 15. Half received the vaccine, half did not. There were 18 cases of COVID in the group that was unvaccinated. So in this clinical trial, there was 100% efficacy for COVID-19 vaccine amongst adolescents 12 to 15. They also looked at safety in the trial and found the vaccine to be safe, with most common side effects being fatigue, headache, or muscle or joint pain, similar to those who are the side effects that are seen in people 16 and older. So many people, as I mentioned, are recommending COVID-19 vaccine for adolescents, including the American Academy of Pediatrics. But also there was a op-ed where more than 60 North Dakota pediatricians and other healthcare providers signed on to a letter recommending COVID-19 vaccine in North Dakota. And then to date, 22.3% of children ages 16 to 18 in North Dakota have already received at least one dose of COVID-19. So there's still additional children to vaccinate. And then just to plug that there are other vaccines that adolescents are recommended to receive, including vaccines that protect against whooping cough, tetanus, diphtheria, cancer-causing human papillomavirus, and meningitis. And luckily, yesterday, the CDC came out with recommendations that COVID-19 vaccines can now be given at the same time as other vaccines. And so previously, there had to be a 14-day spacing, and now they can be given at the same time. And so get your child an appointment today to see the pediatrician to get caught up on all adolescent vaccines and discuss COVID-19 vaccine with your child's healthcare provider. COVID vaccine, again, is available at various healthcare providers, local public health, pharmacies, Department of Health pop-up clinics. You can also go to vaccines.gov and put in your zip code, and you'll find a number of places that are offering COVID vaccine. And a new program that the federal government has stood up is that you can text your zip code to Get Vax 438829, and it'll send you the 3 nearest locations to you where you can get COVID-19 vaccine. One other thing I wanted to address, there has been some rumors on the internet and in the media about deaths after COVID-19 vaccine. One media report reported that between late December and last month, a total of over 3,000 people died after getting COVID vaccine in the United States. The truth is that the claims are very misleading. The report is citing numbers from the Vaccine Adverse Events Reporting System, VAERS. VAERS cannot determine if one event is caused by another. So it can't determine if somebody dies and it's due to the vaccine. It's used to determine safety signals and used for vaccine safety surveillance. We're vaccinating millions of people per day, and it's likely that someone is going to die after vaccine because they would have died anyways, regardless of vaccination. So to determine if a vaccine is causing a death, they do additional investigation and studies. Let's see if I have anything else. I think that's all I had to mention today. Michelle Detloff is here from our epidemiology department to talk about any questions you might have on CDC's new guidelines on returning to normal after vaccination.
People want to know is what's the plan? Who's going to be able to vaccinate adolescents? Will there be mass vaccine clinics like there were for adults?
Yeah, I know that there are a number of local public health departments and even private providers that are already planning school-located vaccination clinics before the end of the school year. Now, schools end at different times, so it's probably going to vary by your location or what school district you're in, whether or not you'll have a school-located vaccination clinic. But I know a number of those are planned, and any school who's interested in having a clinic can also contact us at the health department, and we'll help facilitate that. Otherwise, yes, there will be a lot of large vaccination clinics. Children can get vaccinated at their pediatrician's office, at the family practice office, local public health. Pharmacies are able to vaccinate adolescents, so they could go into their pharmacy and get COVID vaccine as well. Yep.
So you guys with the health department put on a great event, I think last week, a town hall with several doctors in the state. And you know, I had asked them about herd immunity. They seem to think that a lot hinged on the uptake for adolescents, the vaccine uptake. They were also not very confident that the vaccine uptake in adolescents would be high enough to reach herd immunity. I'm just wondering, how much do you think hinges on that uptake for adolescents, and do you believe it'll be high enough?
Well, I think national surveys are reporting about 50% of parents willing to vaccinate their adolescent against COVID-19. And I think national experts are varying on what exactly is the rate that's needed for herd immunity. But normally we hear rates of 70, 80%, something like that. I think herd immunity for COVID is going to be challenging. One, because we're not seeing the uptake that we want, even in North Dakota. Our goal was to have 70% of adults vaccinated, and so far, 51.9% of North Dakotans 18 and older have received one dose, according to CDC's vaccine tracker. So we're a ways away from that 70% rate. Additionally, young children can't get COVID vaccine yet, and so that will definitely impact the ability to reach herd immunity. And then worldwide, there's a lot of countries that don't even have access to COVID vaccine yet. And the United States, I think the one thing we've learned throughout this pandemic is we're not in a bubble. If we have to vaccinate the entire world, not just the United States, in order to prevent COVID-19. And so it's going to continue to circulate unless we can get high vaccination rates amongst everybody worldwide.
And then a follow-up to that, do you think that, this development today has the potential to be a jump start to the state's vaccination efforts, which have, I guess, stagnated a little bit more recently?
I hope, I know what some people are going to say. They're not wearing masks anyway, so thank you for telling me I no longer have to wear a mask, or whatever is happening right now on social media. But I'm hoping that it shows what confidence experts have in the vaccine. They're basically saying, regardless of other people being vaccinated or not, if you're vaccinated, this vaccine is highly effective and is preventing you from spreading COVID to others and from getting severe COVID yourself. Now, having said that, these vaccines are still not 100% effective in clinical trials. They were 94 to 95% effective. And so if you vaccinate, the more people you vaccinate, then the less hospitalizations and deaths we're going to see. And so that's why we still want to have a high vaccination rate. Yep.
In regards to vaccine hesitancy, it was North Dakota was one of the worst states for it. How do you guys plan to go to tackle vaccine hesitancy in regards to adolescents if some of their parents won't even get vaccinated?
It's definitely going to be challenging, and I think it's going to be a marathon and not a sprint, probably. I think we're going to have to do quite a bit of education about not only the vaccine, but COVID-19 illness. I think a lot of people think it is a minor illness, and COVID-19 disease is much more severe than influenza. I think for childhood deaths in the United States, the numbers are double of what we normally see during a flu season. And so, and you shouldn't just look at deaths. I talked about hospitalizations, long haul COVID. And so parents really just need to have that conversation with their pediatrician. And I think that's where it's going to start, is having that one-on-one conversation, getting questions asked, and knowing that a trusted healthcare provider is recommending COVID vaccine.